Okay, hello everyone. My name is Dr. Lauren Brim, and I have Dr. Neel here today, who is an integrative airway and feeding chiropractor. Hi, Neel.
Hi, Lauren. It's amazing to be here.
Yeah, so I founded Bodywork for Babies, and we talk a lot here about working with the fascia of babies and working in the mouths of babies. And I thought that our practitioners and students would be really interested in the work you're doing because you specialize in the floor of the mouth. So, first of all, can you tell me how did you get into working in the floor of the mouth?
Yeah, I'd love to. Yeah, I think my really specific entry point into that was when my daughter was born, just under 9 years ago. I'd already been a chiropractor, started 17 years ago as that, and then got into fascia, adjusting organs, following patterns on people. But yeah, when she was born just under 9 years ago, and our midwife, home birth, our midwife said, "Your daughter has a tongue tie," and I was like, "What is that?" And
Mm.
she told us what it was, and then down the rabbit hole we went, and like I was doing, you know, hours of body work on her a day, gentle, freeing up tissue, and then working on her body, working in her mouth. I just started to find what can I do to help alleviate tension. I also brought her to other body workers who had more experience with that, seeing that I didn't know anything about this issue.
Hmm.
And in the end, it was like 2 weeks of nothing working, all the cranial, all the fascial work to
Mm.
really help with breastfeeding and really move the dial for that with my wife and for her, Serenity. My daughter's name is Serenity.
Hmm.
Weeks later we had a tongue tie release with a laser procedure, and that it was a night and day difference, and yet I still needed to do an hour of body work on her aside from the post-op stretches in order for her diaphragm, her kidney, her intestines, her floor of mouth to stay supple and loose. And then it was like once we got past like those 6 weeks post frenectomy, I was doing still like body work on her once a day for months. And then I finally saw after like 3 months, like things stayed and remained. And so it was in that time that I really did deep dives into what was working, what wasn't. And also I started to look in all the mouths of the babies, of course, started there, and then the kids, and then pretty soon every adult, hands down, full on intraoral eval on everybody to assess. And that's kind of where I started to see a lot of patterns on how to navigate these, the whole body through the
Hmm.
context of the floor of the mouth.
Hmm. Well, that's a lot of body work for a baby. Do you
Yeah.
feel do you feel like it was like two steps forward, one step back, or there were just that many layers, or you were just kind of figuring it out and that's why it was so much? What are your thoughts?
Yeah, I mean, I think there's like the um going back, what I know now, it would have been I could have done it way quicker. uh, because of the floor of the mouth protocol that I've created, and now the airway map where I've created these connections of understanding so many areas, and yeah, trial and error. I don't think it would have taken me so long, but I think at that time I was using what was not only I figured out, but what everybody else had figured out. So
Hmm.
I think it's wouldn't have taken that long, but I also think it's good to underscore for me anyways that she had so many issues and there was such tension that it was still going to be a journey even
Yeah.
if I take what I know now.
Yeah, and some babies, I see that in my practice too. It's like it's fun when you do one body work and you get, babies latching and torticollis resolving and you see some babies respond really quick and then some babies you're on the sixth session and their reflux is
Yeah.
terrible. They're gagging on everything. Like the sleep's a mess and it's like, am I doing something wrong? Is why, and why is this baby so tight? Like this
Yeah.
family seems okay. I go into a lot of homes where doesn't seem like the environment's so stressful. I see mom and dad respecting each other and whatnot. But I know you teach in your courses a lot about what's going on with the embryo and the separation of the tongue from the floor of the mouth. And do you want to speak to your theories around what goes wrong? Like, why are we seeing these babies with all this tension in the floor of the mouth affecting breastfeeding and regulation and total body function?
Yeah, it's like a I think if I stick to the embryology part of how we form and look at when the mouth forms in that fourth, fifth week, gestation. So barely into this world in the womb in
Early.
utero.
Yeah.
Yeah, that's when the mouth forms, the pharyngeal arches. Well, it's like right at that same time the diaphragm forms right below the mouth and the throat. And so we have neighbors, the diaphragm and the mouth forming right there. And then at 6 weeks, the diaphragm goes down to the thoracics. And then at 8 to 10 weeks, the diaphragm dives down into the belly where it lives now. And then we have it lands where the right kidney, right adjacent to the kidney, and we have the kidneys are not symmetrically aligned in us. They're already different heights. And
Hmm.
I think that fascial journey where the mouth forms and the diaphragm descends is just one example embryologically of how fascia starts to spin. And with those of us who have tongue tie, narrow arches, narrow palate, any of these things, and even all the babies that are born with a deviated septum, which is just more and more being seen with in conjunction with these issues. I mean, I think that's more of like the what is happening and the why I think that the body then spins into this tension. The why is like, yeah, that's the perplexing thing of all the theories on, is it nutrient deficiencies? Is it toxicities? Is it pathogens, infections? Is it, EMF sensitivity and plastics and pesticides? And then we have like in utero, like you mentioned, what stress is going on around that family.
Hmm.
Yeah, I think it's all the above. And I think there are these epigenetic triggers that
Hmm.
manifest in the body. And when it manifests, it can create a ton of issues. And on some families, we just see like, wow, you had all these kids and they did this. And then that one baby came out and not so much. And so I think some of it is like a mystery that all of us are really, in some sense, are trying to figure out and solve. But you add in like the anthropological concerns about, yeah, baby foods and there was that time when there wasn't breastfeeding was discouraged, and so we have these things like set in motion a long time ago that was
Epigenetics from the ancestors, you mean?
correct. Yeah,
Mhm.
yeah, exactly.
Yeah. Yeah, and then you also have the later part of the development of the fetus where mom's uterus is really tight and babies don't always have much space, especially it seems like a lot of women, their first babies are in a really tight womb where they don't have a lot of space and they come out just generally tight, and then you see a lot of later babies that moms say, oh, they were in one position really low the whole end of the pregnancy, and those babies often, I notice, seem to have a lot of tension on one side of the floor of the mouth, or how they're positioned also seems to play a big role. But I think looking back at this development you're talking about during the organogenesis period and such a fragile part of the development of these major organs and fascia, the respiratory diaphragm, is really interesting. And yeah, and we want to help babies recover from that tight fascia so they can thrive in all ways, not just breastfeeding, but breathing and digestion and organ health and all of that. So I know today we're going to talk about something that is really challenging for a lot of practitioners, which is the hypersensitive gag reflex, because if they've trained in my work or CFT or CST, they know they're supposed to go in the mouth. But what do you do when you just barely are putting your gloved finger inside a baby's mouth and some babies are gagging upon
Mm-hmm.
gagging, and the parents are getting scared, and some babies are even start vomiting because they're gagging
Mm-hmm.
so hard. And so, I could talk about my approach, but I'd also love to interweave that with your approach. So what would you do in that case, and what have you found to be really effective in treating that?
Yeah, it's definitely the hardest thing is to see when you know that there's an answer and you can like pretty much guarantee like if I could just loosen that or do this, and then but then you're like something, and I've seen this on adults as well. I've seen it on adults who have like such a hypersensitive gag
Mhm.
reflex. And so, in working with all ages at remediating and finding what's the quickest pathway to removing the hypersensitivity in certain cases, because sure, it's there for a reason, it's protecting, but as we know, nervous systems are too vigilant these days at dangers that aren't there. So clearly a finger in the mouth, we're not trying to do anything negative, and the body is thinking don't do it. So I like to take a second to figure out, why is the body being so vigilant? What is the hypersensitivity from? Is it from the body? Like you said, is it an unsafe environment around them? Is it, can I ascertain anything about their the village around them? Is there anything unsafe? Of course, we can talk about like EMF sensitivity can create this issue in some. And then, but something I like to do is try to find out where it's coming from if I can. And then I'll speak to like hypersensitivity in general, nervous system hypersensitivity. I have one baby that I remember just, mom was so concerned. She said, it just feels like when I'm doing these, stretches, let's say in the mouth post op, it's just hurting so much, or I'm worried that it's hurting. And I just took 1 second and I felt under the left side of the floor of the mouth, which is usually tighter than the right in my experience. But I lifted up slightly with a pinky and I could just feel that tongue push against my finger. And that's for me a clue enough that the tension isn't originating from under the tongue. So if there's pushback, any resistance at all, then I know it's somewhere else. And if I can get to that tension somewhere else in the body or the field, that tongue's going to be easier to lift. There still might be tension. This case, I could just see the grimace on the baby, that little fear. So then I thought, I know this baby. I have the fortune of having seen this baby once before and knew that sound, like sensory issues were there. And I just mean like loud sounds startle so easily,
Mhm.
more than normal.
Okay.
Um, but in this moment, I could pick up that it was the sense of smell. So what I did is I had her, we brought a candle by and just smelled the candle, and instantly the floor of the mouth tightened more than
Hmm.
it was already. So that's a way you can test this out. And I thought, oh boy, so I know there's a sensory component. Well, there's a few ways to do this. I just happen to have a simple 405 nanometer purple laser, violet light. Few $100 laser, amazing. You could do this with red light, although purple, in my experience, is way better at handling airway and feeding issues with nervous systems that are dysregulated. Red light can help, but sometimes it can be a little stressful to a body when it's not fully regulated. So, anyways, violet laser, just intranasally for 10 seconds,
Hmm.
instantly the floor of the mouth was way looser. And
Hmm.
and then that way easier to lift that tongue. And this baby who had had a hypersensitive gag reflex, that wasn't present either. So in this case, I think it was helpful to note that the hypersensitivity was first with the senses. Then
Hmm.
the gag reflex was second to that. So that's
Hmm.
sometimes the answer, is to find out where the root is. Um,
Hmm.
and then, and then we can get to like, well, when it's like you maybe you've done that, or there's not really showing like evidence of any of that. Um, yeah, sure, it helps to know my map of all the 70 areas, but
Right.
let's
So
just
guide us through some of the structural places. And since this is speaking to body workers, like what are some places that you found they should explore on that baby? Because ultimately they want to get in the mouth and
sure.
feel the palate and the tongue and the cheeks and all around. But where might they go, or what might what's your approach structurally to help release
Yeah.
other areas so that mouth is more responsive to the finger coming inside?
And I'll say that the shortcut through is that I use intuition and empathic abilities to just feel and see and know. So that's going to be my way of going right to where. But let's just say you're using your intuition and you're feeling the body. Let's just check the diaphragm first, right? And you feel under the T12 rib on the front of the body, and you can feel where that tension is.
Hmm.
Sometimes people are releasing the diaphragm, working on the fascia. Maybe you're doing. I find it's not always just by unwinding fascia with the diaphragm that it gets solved. Sometimes you have to do gentle tissue work on the diaphragm to help it.
Hmm.
I think that really helps.
And are you usually holding like anterior, posterior on the diaphragm and kind of feeling in, or using more of your fingers or your palm? Like what does your
Yeah,
work look
I know
like?
that there's like sometimes where like let's just say you're cradling baby like this,
Hmm.
and you're using your fingers and your thumb,
Hmm.
fingers on the left side of the diaphragm, thumb on the other side, fingers
Hmm.
on the right, thumb on the left, and you're palpating inside of that T12 rib
Hmm.
on the abdomen, and you're using that kind of work. If you've got a baby on the table or in your lap, then
Hmm.
you can similarly use hand behind the rib cage and then fingers on the front. But sometimes I'll just use thumbs to trace that T12 and work directly into that. But
Mhm.
I'm going to find on most there is more tension on the right side of the diaphragm due to the way that it's oriented. Like it's bigger
Mhm.
on the right, the diaphragm
Mhm.
is bigger on the right, but
Mhm.
also it's because often that right kidney is going to be more restricted in most babies, you know.
Mhm.
So, but I think a missing link that I've seen in my own life is when I've worked on the diaphragm and I loosened it, great. But what I'd say is if you loosen that diaphragm and check in the mouth so many times, it's going to
Mhm.
get easier to work in the mouth. And that could be the source of that gag reflex sensitivity.
Mhm.
But some people, like, you're not going to find that. But I'll say, well, what happens when the baby is on your right side? Because that'll change as if to simulate breastfeeding. Not only that, put that baby in tummy time, whether you're doing
Mhm.
on the table, on your lap with assisted tummy time, work on the diaphragm there.
Yeah.
Then even get the baby on the side. So if you're checking
Mhm.
the diaphragm in every single posture position that that baby could be in,
Mhm.
and you've released it fully,
Mhm.
then that could sometimes be what removes that hypersensitive gag reflex if it's there.
Yeah, I find that I mostly work with the diaphragm in tummy time because I find that most babies tolerate that a lot better and it's easier. A lot of babies are distended with gas, and I find I can get in there better. Do you have a way of working when you've got a really distended belly? How do you do
Yeah,
that?
I think often in those cases, it's like, yeah, you just got to find whatever, like it's so different for so many babies. So, because if it's the ileocecal valve of the colon, if it's the actual large intestine, that's the reason they're distended in addition to the diaphragm,
Hmm.
then often, and you can find that by like belly button. And if you go like an inch below it, an inch to the right,
Hmm.
that's the ileocecal valve. But if you just say like intestines, gently massage their intestines,
Hmm.
that can help. But what I'll often find is that right psoas can be the tighter one on these babies. It could
Hmm.
be both. And if you get that baby on their side,
Hmm.
and then you do hip flexion and you bring their knee to their chest, and
Hmm.
then you bring that hip into extension,
Hmm.
and then you can feel into the large intestine and even work on the diaphragm that way.
Yeah.
Sometimes that will just,
I do
change
that
that
too
tension.
with if a baby can't do tummy time and they're so upset, I'm bouncing them and working that on the side. And then I like what you said about the importance of doing both sides because I like to work on the cranial, facial, feet, everything while they're breastfeeding one side and then the other, or the more difficult side for mom because you're going to get different tension patterns present with that. And yeah, I completely agree. So that's the diaphragm work. And then what about and kidney? What about in the throat or face? What do you notice there?
Yeah, another area that I've worked, had so many people come to my trainings and they're like, "Oh my gosh, I was working there and I wondered why that worked." And I love that because I think a lot of us we find answers and they work, and then sometimes they don't work, and then so through like analyzing the thousands of patients that I've seen, I've found that the cricothyroid fascia on the left side, this is my left side. I don't know if it comes through, but
Yeah, yeah.
the cricothyroid fascia on the left side
Hmm.
is more restricted in like 99% of people, babies
Hmm.
with airway issues. And the
Hmm.
way to trace that is, if you find your clavicle, that's the lowest point, and
Hmm.
you have your chin, that's the furthest forward. But then you come down and you find your way about halfway, and there you are next to the thyroid gland.
Hmm.
Often people are, yes, you might be on the scalenes. Where
Hmm.
when you're working with fascia, it's global and it's regional, right? It's not like you're working on a specific muscle.
Hmm.
So you're just tracing alongside that whole left corridor from, inside the mandible down to the clavicle, a little bit above that. But
Hmm.
I often find when you're working on yourself, if you have a hypersensitive gag reflex, it's easier to take your thumb, point
Hmm.
your thumb towards the thyroid, get
Hmm.
on the thyroid, slip down beside it, and then sift through lateral, medial to lateral, those tissues
Hmm.
and there. Then what's often really important, if you're getting inside the mouth at this point,
Hmm.
yeah, you're gonna find that the floor of the mouth will loosen when you work on this. But for these tricky, hard to solve gag reflex issues,
Hmm.
if you're doing this and you check inside the mouth and you're still not that hypersensitive gag reflex is still there,
Hmm.
well, it's really important to see like, how far back are you getting further back? Is, just there's too much to say in this like little bit here, but you can work on the palatine bones. Those are The bipalatine bones are the hard palate, but the back, the maxilla is the front of the hard palate. And then if you go back further, before you get to the soft palate, you have the palatine bones.
Hmm.
And often because of floor of mouth tension, the back of the tongue has not been able to elevate and lift. And the back of the tongue is what's designed to lift those palatine bones to
Hmm.
shift your sphenoid and create all this momentum. And
Hmm.
so if those palatine bones are too low, and
Hmm.
a lot of us, what I hear a lot of people say, and you're pretty like nuanced in your work with this, so I know I'm not speaking to you, but a lot of us out there will say, "Oh, I've got a high and narrow, palate." Well,
Hmm.
they're talking about the maxilla, but that's the result of the palatine bones being too low. So
Hmm.
if we use our reference point and saying, yeah, but what are the back of the palate doing? And then you say that needs to be lifted up. Obviously, you're not going to go boom and put those palatine bones back into place because
Hmm.
that was misaligned from 4 or 5 weeks in utero. But
Hmm.
what you can do, I call this palate re-education,
Hmm.
is you get here
Hmm.
on the right palatine bone
Hmm.
and you push up, but and this is way better in my courses, right? But then you're doing that with one hand, and
Hmm.
then you hold the occiput, the head of the baby, and
Hmm.
you're using your fingers to cup the occiput, and you're gently pulling that occiput and stretching out the neck, like
Hmm.
from this
Hmm.
to this further up, and you're coaxing that palatine bone,
Hmm.
up. So you're just putting some pressure up. Like if you're standing, you'd be
Yeah.
pushing it up. If the
Yeah.
baby's lying down, you're pushing it towards the direction of the head.
Yeah.
I would say if you try that and you
Hmm.
find that yes, you're able to do that with a hypersensitive gag reflex,
Hmm.
and but I've had to hold this for 5 minutes on one baby
Hmm.
consistently in order for it to work.
Hmm.
3 minutes in, no. 3.5 minutes in, no. 5 minutes in, the gag reflex disappeared and the baby began sucking when she couldn't.
Hmm.
And I was saying this was one of those like miracle moments in the room where the dad was
Hmm.
crying because he could see what just happened. And I know some of us are used to that. We linger, and if you linger, sometimes that's when this stuff happens.
Yeah.
Is you just got to give yourselves time to explore, but also for the body to respond.
Yeah, I had one of those moments I remember many years ago with a baby that wouldn't suck on anything, pacifier, breast, finger, and the moment where the suck started, like I started crying too. I mean,
Yeah,
it's sort of like a God enters the room moment, like
yeah,
really powerful. And it's like, wow, because that's a reflex that should be there at birth.
yeah,
So, like, where
yeah.
is it? And then when it shows up, it's so powerful. So the way I teach mouth work is that one hand is either on the occiput or the frontal bone or the maxilla, or so there's like an internal and external component. And it sounds like what practitioners could explore is once they're working with that maxilla to not be afraid to go a little bit deeper into the palate on either side and feel for the palatine and see what goes on there. Because I noticed that even training healthcare practitioners like PTs, they're a little bit afraid to go that deep in the mouth. And I notice even under the tongue, they'll go just kind of right behind the gum, but not like really kind of explore in there. So any tips for someone who feels a little scared to like go deeper?
Yeah, I mean it's like it's good to be careful. So I think, sometimes it's like I respect the desire for those. Some are perfectionists and they're also really prudent and they want to be careful. Then there's fear, right? We have fear. So similar, I honor and respect that. I think it's good to practice on yourself. And I didn't even know this, but before our daughter was born, I was on a journey of intuitive movement. I'm a dancer. I have a history in interpretive dance and movement. But let's just say for the year before she was born, I was doing movement in the morning to unwind and integrate. And
Mm,
in that year, I would spend like 20 minutes to an hour, in these some rare times, 4 hours with moving, unwinding fascia, shifting organs, just integrating. I had no idea what I was doing, but I was consistently getting the back of my tongue, the floor of the mouth, to elevate through arching movements and vocalizations. And so when I reverse engineer what I did, I wasn't working in there with my fingers.
mhm,
I have in tongue press, I include like a lot of different exercises with movement and vocalizations and just ways to get the back of the floor of your mouth to drop in
mhm.
tension and the back of your tongue to elevate more easily.
Yeah.
So for me, I had so much fruit from that in my own life that I was way freer. And when I work in the mouth, I have no apprehension. But
Yeah.
I think for some people, we need to work in our own mouths or get body work in our mouths. And if we
Yes.
have, you'll find, yeah, it might be sensitive, but it's actually relieving. So
Yeah.
go to Lauren, go to people who can work and do that. And if you're already doing that, and if you're, I've had a lot of people like you who have told me that, and um, I think it's just good to say gentle does go a long way. And I think what I see a lot of people doing is trying to work too vigorously in the
Mhm.
mouth.
Yeah.
And I, like I said, by now in problem solving, creating my airway map, which is included in the floor of the mouth course, and not tongue press, but floor of the mouth course. If you're finding tension in the floor of the mouth and the tongue won't elevate, and you have to use any pressure, then you haven't cleared something that could. And
Yes.
if you do, you'll find that it's way easier. So that kind of allays some people's concerns there when they're like, I just don't want to do something that's going to be uncomfortable. Like,
Yeah.
it's totally valid.
Yeah, no, absolutely. I think you hit on some really good points, and I want to talk about your courses, but just to kind of recap, if you're scared to get in babies' mouths, you need to get in your own mouth, and you need to be trading and getting body work because the more as healers we heal and heal our own bodies, the more healing we can witness in our clients. And again, the foundation, what I teach is the body is the healer. We are inviting the tissue to find where it's supposed to be and to expand and to release tension. And so we're never pushing. If you're not licensed, you're not manipulating or stretching, you're holding and inviting. And I love this about your work too, that we're not pushing, we're not hurting baby. We're trying to bring pleasure back to the body. And, one of the mantras I use when latching a baby is breastfeeding is easy, breastfeeding is pleasurable. Like we're trying to bring that back. And for me, when I'm doing this work on the diaphragm, the throat, in the mouth, as you discussed, just bringing in that element of down regulation, it reminds me of when you're talking about your dancing, having moms make sound, having them hum or sing or or shush, and then allowing baby to do those big stretches back as we're working with the dural tube and the pelvis and the neck and allowing them to release and the body to be the healer, I think is so important too. And I hope that all this info gives all of you listening some encouragement to go a bit deeper and explore some new places. And if you're interested in understanding the floor of the mouth more and having more confidence, Neel, I know you have something they could sign up for right now and start tonight, which is the tongue press course, right? Which is $90, 5 videos. That is going to teach them a lot about how to work on themselves as well as other people, right?
Yeah, it's great. And there's a 8.5 minute daily routine video in there that's inside the course. And it's like I tell some people the whole thing is good. But if you just watch that one video,
Mhm.
it puts everything together in the course in an 8.5 minute daily routine. And
Mm,
you can scale that down to 4 minutes. You can scale it down to 2 minutes. You can do it once a day, twice a day. But it gives you a routine that's not only about tongue movement, floor of the mouth working in there,
mhm,
but also like floor of mouth meditation that I created and how to bring mindfulness in and engage with your whole body to
mm.
help coincide with and help promote more of that, looseness that we want to get and tone in the mouth.
Cool. Yeah, what I love about that is it sounds like it is very much a course for you to use on yourself. And I think so many of us get into airway and feeding stuff and go down this rabbit hole. I see so many students who have their own untreated tongue ties or, gag reflex, suck swallow, and then their kids, have that. And some people take my course just to work on their children and cut down
Yeah.
costs for their family. So it sounds like this would be really beneficial too for someone to help themselves and their family as well as patients. And then I know your next course is the Floor of the Mouth Interconnectivity Unveiled. That one's 600 and they get the tongue press for free. What does that do that the other course doesn't do? What does it teach you?
Yeah. And the what that one does is you get tongue press because it's just good for you to have, but also you get the paradigm of what is the floor of the mouth as I see it. What are the intricacies of how it works and how it leads to tension in the whole body? You get the most complete version of the airway map in there with all the points that you can study those.
Okay.
And then you also get some techniques like that you can work on the body with some of these airway map points. And
Okay.
so you kind of get all of that. And and it's really like a, that's a 6 module, 90-minute each, with slides and research articles that are included to give you an understanding of how did I how does this make sense? Is there data that shows that this makes sense? And there is, some out there in addition to some of the articles that I'm working on as well.
Yeah, cool. Yeah, I love to include that in my course too and be like, look, we have science, we have research
Yeah.
that like backs up what for many of us has been an intuitive process of understanding. Okay, so they get the map if they do that course, which is cool, as well as 6 modules. And then if they want to study with you in person, I know that's available too. And can you just, what does that give you that these other courses don't, besides being in person? I
Yeah. Yeah. Yeah, and being in person is so ideal because we get into that room as, in a container where we're engaging as practitioners, and I'm demoing the work on you or
on the
others,
students. Yeah.
and then showing what does this look like in real time? How do you analyze the entire body, even though some people might only be looking at some parts? And
Mhm.
how do I walk you through how you can feel in your hands this work actually happen? The floor of the mouth protocol is what I'm teaching through this, and so you get those instructions. And I mean, I have these different modules that I'm teaching. So, for example, Boise is coming up, and Chicago and Sarasota and Dallas. I think also Dubai and Phoenix, maybe, but where I'm teaching it in 2 days, and it's 16 hours, 4 modules. That's a lot. But in LA, I'm starting off this Saturday, with a 4 hour module, and then there's going to be 3 more throughout the year. And I'm teaching how does this work? How do you do it? How
Mhm.
do you do this actual protocol? And then the other ones explain how do you help people when they're preparing for tongue tie releases or post op? How do you support people through palate expansion or jaw surgeries, very specifically through the work that I've done? And then we also get into what about complex cases, and what do we do when there's, and some of this gets into the weeds. So maybe I'll explain it in part, but what do we do when there's, none of that's working and there's failed tongue tie releases, or just things aren't happening? And, I'll talk about gag reflex a little bit more. I'll talk about whenever there's the mouth, you have mandibular tori where these bony growths are there. How do you work with the floor of the mouth when there is that?
Mhm.
Um, and then the last one is more on like how do you guide families when you're doing this work, but it's also on guided and assisted releases. So
Mm.
for those people out there who are, body workers, or you want to team up with dentists and release providers, like after working with several and finding out how my floor of the mouth protocol can make that easier, how to get into that. But it's not just about the body work, it's about
Working on patients while they're getting their tongue ties released,
working on
what you're
patients
saying.
while they're
Mhm.
getting their tongue
Yeah,
tie
in
release.
the
Yes.
operating room. Yeah,
Yeah.
that's
So
cool. That's cool.
and all of that, maybe you're going to mention this, but because they can all use this code for
Right.
20% off.
Neil gave
And
us a coupon, you guys.
it's right. And
Yes.
it's code is Lauren right
Easy to
here.
remember. Easy, so easy. Yeah, I'm going to include the links for those 3 courses, whether you want to get your toes wet or jump all the way in. And I know if they're listening to this video later, they can click the link and find what city they can, whether it's in their city or they can travel to learn from you. I know, I guess the last question I have is if they take your in person, are they guaranteed they're going to get work done by you?
Boy, I would like to say yes, but if um and I will demo on a lot of people, but what I'll do is if people are coming to LA, you can guarantee getting worked on by booking a session with me. That's the
Okay.
best way to say it. Just
Okay.
no way to I'll know if I can work on every single person, but
Okay. Depends
yeah,
on class size.
depends on the class size.
Yeah, I just know in my journey, those sessions I got, like the little demo sessions in class with my teachers were, some of the most profound moments of my journey. So,
Yeah.
being with the master and experiencing the work in my own body. And then you're like, oh, okay, it's a big aha, big light bulb moment when you feel it for yourself. So
Yeah.
well, Neil, thank you so much for this. I'm going to post this. Everyone can, if you have questions for Neil or I, our contact info will be here. And thank you so much for your time, Neil. And we'll maybe have this conversation again about some other common issue, and we'll see what people think of this. So,
Thanks, Lauren. It was
yeah.
really fun. And I loved learning about how you navigate with your babies and patients also. So
Thank
so
you.
good
I
to
know
be in
it's
this
fun to
convo.
share. I know to find someone to be like, let's talk about what we're doing with babies. So cool. Thanks, Neil. Okay, thanks everyone. And I'm going to